So good evening, everyone, and welcome to this evening's Fireside chat. This is going to be the 181 chat in our series. And today we have a very interesting topic on matters ethics and informed consent in clinical trials. I think for everyone, we do know that patient involvement in care is a very integral part. And our speaker for this evening will be Professor Rajendra Bhimma. I think tonight he wears actually two hats, both as a speaker and one of our panelists who's been with us for quite a long time and a key supporter of this fireside chat. So we are very happy to have him on board. So a little bit about Professor Bhimma. He's a distinguished academic and clinician. He currently serves as Professor of Pediatrics and Head of Pediatric Kidney Clinic unit at the Inkosi Albert Lutuli Central Hospital, which is affiliated with the University of KwaZulu-Natal. He holds a Bachelor in Medicine and Surgery from the University of Natal, a PhD in Pediatrics and Child Health, and he has completed specialized training in pediatric nephrology, earning the ISN Fellowship in 1999. Throughout his career, Professor Bhimma has received numerous accolades, including the David Hepburn Award and several Medical Research Council grants for his research on nephropathy. He has also been recognized for his significant contributions to the medical field, having been named one of South Africa's top 100 achievers by the Mail and Guardian in 2003. Professor Bhimma's leadership extends to international and national bodies, including the Southern Regional Pediatric Nephrology Association, President, and the executive member of the Southern African Hypertension Society. His expertise is frequently sought after, with appointments as an examiner for various academic institutions and as a reviewer for research grants and scientific journals. His research work has been widely published, focusing on pediatric nephrology and other related fields, solidifying his reputation as a leading expert. We are quite excited to have him on board and looking forward to a very enlightening talk this evening on ethics and informed consent in clinical trials. Over to you, Professor Bhimma.
Thanks, Yuri. Thank you very much for that lovely introduction. It's a bit overdone, but I appreciate it. Anyway, as you know, I'm a pediatric nephrologist, but today I'm wearing a different hat because apart from nephrology, I also do ethics. And when I say ethics, I'm talking about research ethics. And so I am the deputy chair of the Research Ethics Committee back home in South Africa, in Durban. And as a result, I have to review a lot of protocols, etc., for research. And one of the major problems that we encounter when we review these protocols is not the scientific value of the protocol, but it is actually on the ethical content. And one of the greatest deficiencies is a properly written informed consent. And this is so important because if you want to do a properly conducted study, of course, you cannot undertake any study without ethical consent. Okay, so I thought it'll be fitting just to discuss this topic, especially for the newer researchers and even for the more senior researchers, because we did a little survey, and unfortunately I can't release the data, but we looked at the informed consents and where there were flaws in informed consents, and surprisingly enough, many middle tier and even a few senior researchers, have a problem putting together a good informed consent. So therefore, I thought we'll discuss this topic in a little more detail. So I just have a few disclosures to make. Obviously, I have no conflict of interest, right? But I'm not going to specifically talk about minors and children, although that's a topic close to my heart because it's quite involved, about waivers of parental consent for adolescent research or research in legally incompetent persons. That means like doing research in ICU or in mental hospitals, etc. Then special populations like prisoners, etc., like cultural notions of consent or community consent, and then online research. Now, each one of these are very specialized in ethics, and I don't want to go into them because it's not often going to involve us because we are usually doing research more in adults. I will touch on children a little bit. And of course, if we have any questions, you're welcome to ask them and I'll address them. To look at ethics itself, clinical research involves a systemic attempt to improve, firstly, the health and well-being of individuals, and then to identify improved methods to prevent, treat, and cure diseases and illnesses. And informed consent is one necessary foundation for ethically sound research. And one of the significant roles of the Research Ethics Committee is to ensure that the consent process meets all acceptable standards. And then researchers have a duty to provide potential research participants with information and opportunity to give the free and informed consent to participate in research. And that statement is very important, that it has to be informed. They must be given opportunity to understand what they are going to be doing, and it has to be given voluntarily, and they have to be signed informed consent. There is, so it has to be written most times. So why does research ethics matter? Okay, I mean, why do we have to do all this? It's just, many people, researchers think it's just a pain to have to submit your protocol to say the higher degrees committee or the research committee, and then again to submit it to ethics. And they say, but it's the same process. Well, it's not the same process, okay? Because research ethics is involved in protecting participant safety. That's very important, okay? The second thing is that it's maintaining scientific integrity. Thirdly, it is important in upholding human rights and dignity, and you must ensure social responsibility. So the research that you do has to be relevant to the population that you are researching, and it must be of benefit to them. And it has to involve building trust in research and research institutions. Okay, we must be doing something where the participants feel that this research is not going to be of value to them, but they are just being used. And lastly, but not least, it's complying with legal and regulatory compliances, and that is very important. So when we review a research protocol as ethicists, we have to look at each one of these 6 components, okay? And we have to ensure that all of the research that we review meets each one of these criteria. If they don't meet any of these criteria, then we have to send it back to the reviewer to say, to the researchers to say, look, this is where the flaw is, and we want you to review your protocol all over again. So if you look at it, there are 8 requirements for ethically sound research, right? You have to have collaborative partnership with the participants that you are researching, as I pointed out. And once again, as I said, there must be social value to this research. So it has to be relevant to the participant or the community that you're doing research. There has to be scientific validity and integrity to your research, and you must have fair selection of participants, okay? Right? If you don't have that, or for any reason that you are taking a sample which is a convenient sample, etc., then you have to state that in your protocol, okay? That we are doing convenient sampling, and you must stipulate reasons as to why you're doing this. Otherwise, the research is biased, okay? And it's not going to be have a wide scale applicability. It must be a favorable risk-benefit ratio. Now, we know that with everything that we do, right, in medicine, right, whether you're giving a medication, whether it's a simple thing like paracetamol or multivitamin, or you're giving some high-potency cytotoxic agent, all of them have certain side effects, right? But the important thing is that the benefit that accrues from the research that you're doing, especially if it's interventional research, must outweigh the risks that are involved. Okay, the research that you're doing must be independent and be competent, have competent research ethics reviews. So, in other words, if you are undertaking a research study and you produce a protocol for it, it must pass through the IRB or the Research Ethics Committee, and you must have authorization from the committee, full ethical approval before you commence study. And you'll know from the senior researchers who know, and even the juniors, that if you want to publish an article in a reputable journal, one of the things they will ask you is whether this has had being reviewed by research committee, and they often want to know what the number is or whatever detail you begin from the research committee to say that this protocol has been reviewed. So, for instance, for our committee, we will say the biomedical research ethics number is that. So we know that that's what we will look at if the journal asks us. And not often, but sometimes we get a request from the journal to say, look, this article has been submitted to our reviewers, but we'd like to know whether it has ethical approval, and then we have to produce that ethical. So that's very important. And then there must be ongoing respect for the dignity of participants, and not only for participants, but the dignity of researchers as well. Okay. And lastly, but not least, you must have adequate informed consent from the participants before you undertake this research. Okay, so that's very, very important. So what are the duties of the researcher? It is to seek and obtain consent only after you have provided relevant information about the research and ascertaining that the potential participant has adequate understanding of the material facts that are there. And that's very, very important. Okay, the participants must understand, and you have to put it in a language that they can understand, to say, this is what I intend to do, this is what I expect from you, and this is what are the possible adverse effects or possible discomfort that you're going to suffer from whatever intervention I'm going to be undertaking. You must refrain from unjustified deception or withholding of relevant information. You must refrain from undue influence or any form of coercion. There cannot be any coercion, there cannot be any inducements, okay, to get participants to participate in the research. You must ensure that the potential participant has been given sufficient opportunity and time to consider whether to participate or not to participate. So you cannot take a consent form, stick it under someone's participant's nose and say, okay, I'm doing this research, can you please sign here? Okay, that's not acceptable. You have to explain that research to them in detail. They have to be able to study your information document, and then when they are happy and they've asked questions, etc., then you are able to get an informed consent from them. You must obtain potential participants' signed form as evidence that you have explained the study to them. Okay, and that form has to be given to the participant, and one is kept by you, and then we demand sometimes that that form be sent to the ethics committee as well, so that we have proof that you have actually taken informed consent. And then researchers must justify any exceptions to this general rule, and before they apply this rule, they must seek approval of the research ethics committee. So let's just say if you are taking consent from people who have a stroke or whatever it is, and they are not able to talk or not able to understand, then you have to apply for a special waiver of consent, etc. Or if they are not able, if you're taking consent from illiterate people and they're not able to sign or something, and you're taking thumbprint, you must inform the research ethics committee that, look, I am taking thumbprints for my patient because they are not literate and they are not able to sign or whatever it is. So that's very important, okay? And researchers must renew the informed consent of each participant if there is any substantive change in the conditions or procedures of the research, right? Or if information becomes available that would affect the willingness of the participants to continue. So let me just break that up. The first part is that if, for instance, halfway through the study, you decide that with this intervention, it's not working very well, you want to do something else, okay? You want to change the protocol slightly. You have to apply to the research ethics committee with an amendment, and then when they look at it and they approve that amendment, then you have to change your consent document to say, okay, we are going to do this, this, and this, and take bloods, etc. at this time, but in order to further this research, we want to take an additional set of bloods 6 weeks later. So if that is 6 weeks later, blood sample draw is not in your informed consent and you want to change it, you have to get permission from the ethics committee. If, however, you find after that you have made an intervention, and let's just say that you notice that patients who are taking a particular agent or medication, etc., are experiencing a bit of abdominal cramp, etc., and you want to use something like Buscopan or something to try and relieve that, but that wasn't in your protocol, you have to apply to research ethics committee to say, I'm going to do this, And then you will change your consent document to say, look, you'll be given this medication, but because you might most likely to experience abdominal pain, we're going to give you this medication to relieve. Okay, so any change that occurs, each step must go through the research ethics committee. So there is this International Conference on Harmonization, right, for good clinical practice, which is the ICH. And it lists 20 items as essential to informed consent. It's important to note that to give valid consent, potential participants should understand the nature of their options. So if, for instance, you are doing an interventional study and there are other interventions available. If you're trying to test drug A, but there's drug B and C, you have to tell the participants, look, you don't have to use my medication, you can use B and C, but we are doing a trial, etc. And we'll really be grateful if you could participate in this trial. Okay, so it's very important that they are given options that are available to them so that they understand why they have to do the study. In particular, participants should understand the risks, the potential benefits of the procedure, and alternatives to the study, which I've just outlined. Right? So you must explain what are the benefits of your medication compared to what is available out there. Secondly, what are the potential risks involved, and then you must make it known to them what alternative medication they have that is available to them. And then the informed consent process should include a step in which potential participants are invited to ask questions and express concerns, like I said before. So they must be given that opportunity. So what is the purpose of obtaining informed consent? So the requirement for informed consent allows competent individuals to decide whether participation in research is consistent with their interest. Okay? And that's very, very important, right? So if you are to take consent from a particular group of participants who have a particular disease, they obviously want to get better from the disease. So they have a very vested interest in it, right? And you have to explain to them that this is the disease that you are interested in, and this is the disease that this medication is going to help you with, but these are the side effects, etc. So they understand what their interest is in participating in that research. The goal then implies that individuals should understand that information, and they need to determine whether participation in a given study is consistent with their interest. No point in giving them medication that is not going to help their particular disease but show something else. So it's no point if the patient is suffering with asthma and then you want to try an antibiotic to treat pneumonia. You know what I mean? And say, okay, I just want to try it on you to see if this works or not. Okay. So they're not interested in it because they don't have that condition. So informed consent allows individuals to decide for themselves whether they're enrolled in the study in question. And for this purpose, potential participants should be provided with the information they want or they need, or to decide whether they want to enroll in the study or not. And so that just emphasizes the point that I made, that everything must be made open to them. There must be transparency about what you're doing and what are the benefits, what are the risks, and whether they really want to participate. So what information is relevant to the potential participants' interest? And there's a very interesting quotation by Wedler that's often quoted in the ethics journals, and that is, a life goes better if it includes valuable experiences and grows less well if it includes negative experiences, such as significant frustration or pain. Okay? So people are always looking forward to look better. They're always looking forward to feeling more comfort, more peace, etc. So that is what they're looking for. Okay. And the fact that we have a strong interest or have certain experiences and avoiding others implies that potential participants should understand how participation in a given study will affect them. So if your medicine that you are going to be investigating, your drug or whatever it is, has certain side effects, you have to make it known to them that these are the potential side effects that you can expect. And then they have to decide, look, whether this discomfort from that medication is really worth it or not. Okay. It might cure the epilepsy, but if it makes them sleepy the whole day, they might not be wanting to use that medication because they have to go to work. You know what I mean? So you have to explain to them that this is the side effect that this medication is going to have. And this information is essential for determining whether participant is consistent with the participation, is consistent with one's interest. So in other words, they have to then decide whether they really want to participate in the study or not. So that's basically an outline of what ethics is about, and taking an informed consent and how you're going to recruit patients, and what you need to do for the informed consent. So let's go through it in a little more detail. And so what I did, I looked at our research ethics form and I went to it to see what are the relevant features that we look for as a reviewer when we review these consent forms, so that we can make researchers or investigators aware that, look, this is what the information we are looking for, and therefore this is what you must include in your informed consent document. The first and foremost statement you have to make after you introduce yourself, of course, is that this study involves research. You have to state that it is not part of clinical practice. Okay, you have to tell them that you are doing a research study. Then an explanation of the purpose of the research and the expected duration of the participants' participation in the research. So that's very important. You have to then explain why you are doing this research. So sometimes people say, we are doing this study and I want to look at this drug, this, that, but they don't mention that, look, I'm doing it towards a part fulfillment of my master's degree, or I'm doing it as part fulfillment of my doctoral degree. You have to state that. Okay, otherwise that's withholding information, because you have a vested interest in that particular study. So you have to make it known to the participant that, look, you are assisting me to get there, because your interest is very different from the participant is not interested in your PhD. They're interested in getting better. That's all they're interested in. Okay? So they must understand what the purpose is of the research. Then they must understand for how long they're going to be in that study. Okay, so if they require regular follow-ups, especially if it's out of times with clinical follow-up, etc., then they need to know what is involved. And they need to have a description of the procedures that are to be followed, right? And you must identify any experimental procedures. So whatever, if you are doing, for instance, a drug trial, and you are going to be taking blood samples from the patient, patients know that they often, when they come to hospital or clinics, etc., they get a blood drawn. But what they don't know is that you might want additional bloods to be taken. So they have to be made, and that additional blood may be used for some other experimental procedure. So you want to do some maybe genetic testing or some other thing. So you have to make it known to them that this is what I'm going to be doing. Then a description of any reasonable foreseeable risks or discomfort to the patient. So if you are taking more than expected blood, you have to tell the patient that, look, this may amount of blood, especially in children, etc. If I take this amount of blood, if I need 10 cc's of blood, your child might feel a little dizzy or might feel a little weak. You have to inform them. Okay. So what are the risks involved? There might be extra bleeding, you might get a hematoma, or you might introduce infection. Then any description of any benefits to the participants or to others which may be reasonable or expected from the research. So you have to outline what are the benefits. So that is good, but you also outline what are the risks involved. And a disclosure of appropriate alternative procedures or costs of treatment. Like I said in the beginning, you have to make it known that, look, you're not obliged to take this medication, right? There are alternatives, okay, that you can take if they are available. Of course, if it's not available, it's very unlikely you're going to be using them, right? For whatever reason, maybe the cost is too high, or there just isn't any, right? The other thing is that to tell you, nowadays, placebo-controlled trials are very, very uncommon. I don't know when last I reviewed a protocol that involved a placebo control, unless there is no available medication except for the one that you have. Okay, so whatever study you are doing, you have to have standard of care tested against whatever experimental medication or intervention you're using. And then a statement describing the extent to which confidentiality of the records identifying the participants. So you have to tell them that, look, if we are doing the study and we have to do an HIV test, or we're testing you for syphilis, or we're testing you for this or that, or whatever other condition, or we're doing genetic testing for Alzheimer's disease when you are still 20 years old, and so we don't have to report that to your insurance company or whatever it is. So you have to say that that information will be held confidential only by you and your fellow researchers, and that all data on the consent form and on all the other information that you're taking will be de-identified. Okay, so there will be no identification on that. And we insist on that, especially in ethics. So what are some of the additional elements that are part of the informed consent? There must be a statement that is significant new findings developed in the course of the research which relate to the participant's willingness to continue participation, then you will make the participant aware of this. So if there's anything new that comes up, let's just say if you're testing a particular agent and you find that it's having serious effects, of course, the DSMB, the Drug Safety Monitoring Board, may stop the study. Okay? But even if they don't intervene, or if it's not so severe, but it's something new that came up, you have to inform participants, look, we didn't know about this particular side effect of this medication, but in the last 10 patients that we studied, 3 of them developed this kind of side effects. So they must get known to that. And then you have to inform ethics about that and then have an amendment to your informed consent. The appropriate number of participants involved in the study, you must tell them that, look, we are recording so many patients and we're only going to stop the study when this number is reached. And there must be a statement as to whether research is part of a degree requirement. I think I told you that in the beginning. And this is often eliminated and not put into the informed consent document. Okay, people don't state that, look, I'm doing this part as my master's, or I'm doing this as part of my fulfillment of my doctoral degree. Because they feel it's, they're just doing the study. You know what I mean? So it's very important to say that you declare upfront that, look, you have a vested interest in doing the study because it's part of your. So for research involving more than minimal risk, so what is minimal risk research? So minimal risk research is where, firstly, there is no active human participants involved. Okay, you notice I keep using the word participants and I don't use the word subjects. We don't use that word anymore. Okay, you are not allowed to use it. Okay, it's a little derogatory. So please, if you have in your informed consent document or anywhere in your protocol or anything that subjects to that, you have to change that word to participants. So for research involving more than minimal risk, and so minimal risk is where, say, you are doing, like example is a retrospective review of patients with, say, a nephrotic syndrome or something, okay, in your hospital. So now that is a retrospective review. Okay, so it's minimal risk because there's no active intervention, there's no active participant involvement. Is what happened in the past, right? Because it's a retrospective. Then an explanation on whether any compensation will be provided, and an explanation as whether any medical treatments are available if injury occurs, and if so, what they consist of, or where further information that we obtain is given to the participants. So what that means is that basically you must be able to say that if you have this particular side effects, etc., or if you fall ill, etc., you will be referred to this particular hospital or this particular clinic, to the doctors there for further treatment and evaluation. Okay, or you can claim many of these, of course, if you're doing drug trials, etc., by pharma, then of course many of them have insurance that covers it, and you can tell the participants you have to have it in your document that you are insured for this, and therefore you can claim on that insurance, and your medical bills, etc., will be covered. Okay, so that's very important. In interventional studies, we will not allow any experimental drug to be used on patients if there is no proper insurance, if there is no proper avenues of referral for further medical treatment, and there is no proper documentation of who is going to pay for the cost of those things. So those are the things we look for. An explanation of whom to contact for answers to pertinent questions about research and research participants' rights, and then who to contact or whom to contact in the event of any research-related injury to the participant. So it's fine to tell the participants that, look, if you go home and take this medication, you or your child must get a convulsion. But now when they get that convulsion, they don't know what to do. Now, who do you contact? Who do you find? So your contact information for the researcher, the contact information for the nearest hospital or wherever they are supposed to go to, and the contact information of the research ethics committee has to be on that informed consent document, so that they have that information at hand to contact the relevant authority. Then a statement that participation is voluntary and that refusal to participate will involve no penalty or loss of benefits or reduction in the level of care to which the participant is otherwise entitled. And this statement is very, very, very important. Okay, and we will not allow any informed consent or ethical approval to be given if that statement is not in. You have to state that participation is voluntary, and that if the patient refuses for any reason, they will not lose any benefits. The care will remain the same, and there will be no penalties involved. Okay, they are not obliged to participate in your research study. Okay, so that's very important. And then a statement that the participant may discontinue participation at any time without penalty or loss of benefits to which the participant is otherwise. Now, this is another statement that often is missing from the consent forms. Okay, so there is nothing to say that even if they volunteer to participate in the study, and that study say goes on for 24 weeks or say 30 weeks or whatever it is, halfway through the study, the participant will decide, look, this is becoming too much for me. It's too many hospital visits, too many blood draws, this, that. I don't want to participate any further. They have to have that option to withdraw. Okay, and then they have to be told that if they do withdraw, there will be no penalties. So you can't tell the participant, look, if you don't go for the rest of the 10 weeks in the study, sorry, we're not going to give you any medication. You can't do that. You know what I mean? They have to have all the treatment that is standard of care. Okay, not your experimental medication, but of course whatever standard of care is. So they must have that. So when appropriate, one or more of the following elements of the information shall also be provided to participants, right? Whenever this is the additional information. A statement that the particular treatment of pressure may involve risk to the participant, and we often exclude this, but if you especially are doing an interventional study in women who of childbearing age, then you have to take cautions to ensure that during the length of the study, if there is a potential for damage to an embryo or fetus, or if the patient is likely planning to become pregnant, that they are warned that this medication can result in an embryopathy, and therefore they should take adequate, we call it, protection against pregnancy. Okay, so they have to be covered for that, right? So if in the unforeseeable event they do fall pregnant, etc., you are covered when you say that, look, this is potential risk that may be, or we don't know what the risk of this medication is because so far it hasn't been tested in pregnant women. But you have to cover that yourself with that statement. Otherwise, you are liable to for litigation. Anticipated circumstances against which the participants' participation may be terminated by the investigation without regard to the participant's consent. So in other words, if for some reason that the investigator or the sponsor, whoever finds that, look, they are doing this drug, but they so far, the results from the preliminary analysis doesn't look very encouraging, and so they want to terminate the study, but the participants are still willing to go on with it, then they must be told that if the study is terminated, they will not suffer any adverse events. They must be told about any additional costs that may be involved with participating. So often what happens is that researchers say, we will pay for transport, or we'll pay for transport and meals or whatever it is during the time that the participant is in the study. But they also forget that the participant is working, and that might involve a loss of a day's salary. So they must be informed that, look, this is the cost that we're going to cover, but if there's any additional cost that is involved, then unfortunately you are not going to be able to cover it. And that's understandable. Okay. So they must, but if it's not declared, then you are liable, as a researcher, you are liable to cover that cost. And consequences of a participant's decision to withdraw from participating in the research. So once again, as I said, they will ask you, if I withdraw from this research study or I stop prematurely, what's going to happen? And you have to inform them what's exactly going to happen. And in most instances, the research ethics committee demand that you say there'll be no consequences involved. Okay, very unlikely that they agree to anything else. So documentation of informed consent. Informed consent shall be documented by the use of a written informed process, the written document, right? And the copy of that must be made available to the participant, and one copy should be kept by you. So documentation of the informed consent, REC may waiver the requirement for the investigator to inform consent in certain circumstances. If it's a minimal risk study or a potential harm resulting from breach of confidentiality. Okay, So each participant will be asked whether the participant wants documentation linking the participant with the particular research, and whether the participant wishes this or not will be decided by them. So in other words, if the participant says that I like you to list on my form or on my hospital records that look, I am part of the study, etc., that's fine. If they don't want that, that's up to them to decide. So this is something that we look for in, which is a four-step model of informed consent. And what is a four-step model? Step one is providing an overview of the research study. It's an invitation and introduction with a summary statement on confidentiality, pay after the trial, payments and indemnity. And you have to make it clear that this is a research study. You have to be clear what is being tested, that the participants have a choice whether to participate or not, and the possible choices of the main advantages, that means the benefits that accrue to them, and the disadvantages or the harms that they may possibly suffer, and then what they will be asked to do, which is, of course, includes possible placebo. But as I said, very rarely do we have placebo-controlled trials these days, okay? And most randomized trials are randomized on standard of care. And this can be supported by a suitable key facts summary sheet, or what we call a decision template checklist. So that's the first step, okay, in obtaining informed consent. What's the second step? You have to provide details of the study. That's providing full details using the participant information sheet, which we acronym is PIS, which is PIS, right, as a script to support the conversation, followed by questions and answers, and then providing details, all the details included. Is adequate time allocated to discuss these? And then is there time for questions to be answered? Okay, that's very important, okay? And then the document can support this with understandable short summaries. And wherever possible, when you're using summaries, etc., we encourage people to use emojis or whatever it is, simple diagrams, etc., to explain to the participant, this is what's going to happen, this is what we're going to do, and that is how, and this is the end result, etc. So it makes it easy, especially if your patients are coming from a background where literacy is a problem. Then they can have a break in between to digest all that information, and then we go on to step 3, which is assessing understanding and allowing further questions. So once you've informed them of the study, they've had a chance to study the information document, and they know exactly what is involved, what procedures involved, what are the benefits of participating in the study, what are the possible harms that may accrue, and who is undertaking the study, why is it being undertaken, and who they can contact in the event that they have any adverse events, suffer any adverse reactions, etc. Then you can do an assessment of their understanding of what the study is, and this will depend on the burden and consequences of the closed study. It could be built into an informed consent form adapted to incorporate key facts, okay? So that is very important, right? To say to the participant, have you understood what I said? And then test them on it to say, okay, this medication, what do you understand about it? What do you think it's used for? What happens if you take it in this way? What are the possible side effects that you can expect? And if they are able to answer this question, then you clearly, they understood what is involved. And then, of course, the last step is obtaining their signature from them on the informed consent form. Okay, that means signing up the document. So that's a 4-step procedure, and we encourage our researchers, whenever I give them a talk of ethics, etc., the newer ones, I tell them this is the 4 steps that you should undertake to get an informed consent. So the next question is, what are the challenges that are faced by researchers with regards to taking informed consent? Now, the common barriers are, firstly, literacy level. This is a major problem, okay, especially in low middle income countries, right? So often some patients are very literate, and they can become a bit annoying sometimes when they ask you too many questions and they Google everything. But other patients do not understand so many things, and you have to explain to them in their language. And therefore we insist, for instance, in our province, KwaZulu-Natal, that all informed consents and information documents, etc., be translated into the local language, whether that be Zulu or Sotho or Xhosa, whatever it is, depending on the cultural background of the participant, so that they are informed in their own language what the study is about, right? Especially if you're dealing with patients who have lower levels of literacy. Of course, there are cultural differences, okay, you have to understand, right? And for instance, if you have a drug which is has something from, say, porcine extract, you can't give that to Muslim patients, okay? They will not accept it, because of the cultural influences. Or if you have something of bovine extract and it comes from a cow, you can't give it to Hindus because they don't want to have anything from a cow. They, according to their religion, that is sacred. So you have to be very attuned to the fact that there may be cultural differences when you're obtaining, trying to get participants and recruiting them into study and obtaining informed consent. And then participant anxiety regarding research procedures, okay? For instance, if you have to do intervention in a patient, like say an examination, especially in gynae research, etc., right? If it involves, say, or doing speculum or something, okay? So if it's some type of research of that nature, then the participants have anxiety about whether it's going to be painful, whether the confidentiality maintained, whether they have they're going to be screened, etc. I mean, they're going to be shut off, etc. So you have to explain to them, look, this will be done in a closed environment. It's to be a nurse present, and this will happen, and this is how we're going to do it, etc. So they have anxiety about research before they can sign that. So those are some of the challenges that you will meet when you are trying to get your informed consent. So what are the common pitfalls when you're trying to obtain informed consent? Firstly, this inadequate disclosure. This is again and again something that we find when we review these documents at our ethics committee. Okay, they forget to say that it's part of a study for the master's or PhD. They forget to say what are the potential side effects of the medication or procedure or whatever that they're doing. Or they forget to say one of the other things that people forget to say, they do everything of the procedure and then they leave out the fact that, look, we're going to store a sample of blood for genetic testing later on. Now you have to take a separate informed consent for that, for genetic testing. Okay, so those are inadequate disclosures that we often come across. Rushing the consent procedure, of course, this is something we find it difficult to monitor, but when we get comebacks or we get complaints from the participants, and they email us or write to us and say, look, I'm part of this study, etc. And they weren't explained this. I wasn't explained that I'll have to do this, this, and this. Then I know, right? When I'm reviewing that SAE, that look, this is a rushed informed consent, this patient side. Okay, so that's very important. Technical language and jargon, that is very important. So according to the Bhimma criteria and the International Committee on Harmonization of Research, your language level should not be anything above grade 6 level. Okay, so you must make it there. There's no point in telling the patient that, we are using this medication to see if we can have a decrease in edema. They don't understand what is edema. You understand me? Right? So you have to explain the language that is simple and clear for them. Don't use medical jargon. Then there's a lack of voluntariness. Okay, that's very important, where you tell the participant, but if you don't participate in the study, sorry, we can't treat you anymore. No, it must be voluntary, right? Then there's failure of mention of risk, as I pointed out before. Inconsistent information, okay? This is not uncommon, okay? It's surprising how researchers, I don't think so they do it intentionally, but they often say you that this medication is for this, and somewhere along the line, then they say, okay, but we are trying to solve this problem. And so the participants are confused about what their participation in research is about. So inconsistent information or confusing information, neglecting documentation. Oh, this is something we come across again and again. Please, you have to document every single bit of information. Okay, that is so important. It must be documented, dated, and signed. Okay, especially if you are doing pharmaceutical trials, etc. When the monitors come, they will ask you for every piece of paper. Okay, even if it's a scrap piece of paper that you wrote a little note on, please keep it. They want to know it. You know what I mean? And if you have incomplete documentation, you can be removed from the study, or you might even lose the rights to the study or the rights to publication. So not providing alternatives, this is another thing that you must make it quite clear to them that, look, you can use my medication, etc., but these are the alternatives and you're welcome to use them. Then ignoring privacy protections, I went through that. And then, of course, failure to reconsent patients, okay? Now, often if you change something or halfway along the line, you find this medication is not so good and you want to double the dose or something like, you have to reconsent patients for that. You can't just use the same consent document to say, oh, but we already took consent from the patient and now we just change the protocol. Sorry, that doesn't work. It has to go to the research ethics committee. That amendment has to be ratified at a full committee meeting. You have to change the informed consent document. They have to sign off on that, and then only can you proceed with it. So, enhancing the informed consent procedure, what are innovative strategies you can use? Multimedia presentations, using videos, using interactive tools, and this little, what do you call those things, podcasts, and all these other fancy things. Nowadays, most people have cell phones, etc. Okay, and especially in pediatric research, kids love that. They have a little cartoon that shows them what's going to happen, etc. So that kind of thing is encouraged because it helps the patient understand. Implement follow-up sessions where participants can ask questions about reviewing the material. That's very important, right? Often not done because, research is in a hurry to get the study done. So they don't do these follow-up sessions, okay? And so when we go and monitor them, we say, okay, did you check whether your participants understood what is being said? They got no answer, okay? So then we have to tell them, okay, we're not going to okay this until you have a follow-up visit. Feedback mechanisms, you encourage researchers to gather participants' feedback about their understanding and comfort levels with the consent process, allowing continuous improvement. Right? I must say this is something that is very difficult to monitor and it's something difficult to do, but it is encouraged. Okay, so far, I don't think so. Even our research committee has things in place to monitor it. But we encourage people to gather feedback from the participants to say, when we took this information and this consent from you, etc., did you understand what is going on, how you did, so that they can actually improve it for the next time. That's just a template on the key fact summaries that are there. You can read that when Lloyd sends you the PDF of this presentation. And this is another consent form that I summarized. Okay, what are the key things that you should include in that and what you expect? And so informed consent, then in conclusion, is essential in fostering ethical research practices and maintaining participant trust. It is encouraging ongoing education and adaptation of informed consent processes to meet evolving ethical standards and participant needs. So this is very, very important, okay? And like I said, the only reason I wanted to bring this up at this forum is because when we review protocols, etc., one of the key things that we look at is the informed consent. And if the informed consent is not adequately written and not adequately addressing all the issues of the trial, then unfortunately we have to send it back to the investigators to say, please, these are the information that we need, and you must add this to your. So we must make ethics to look something like this. You must be happy, okay? You mustn't be like this, all right? So it's very important that you plan this and you write a proper informed consent document and follow the proper procedures in taking informed consent. Okay, thank you very much. I'm going to stop there and then hand over to Yuri for any questions.
Thank you, Professor Bhimma, especially for enlightening us on matters ethics and informed consent, especially on clinical trials. I think it's quite important. It was good to see that you were able to discuss most of the ethical principles that should be adhered to, especially on informed consent, on autonomy, on beneficence, which is quite important. Maybe I'll start with a question on my side. I know we're in an era that we try to do a lot of pilot studies, especially to just inform practice. And we do not want to go, the whole way of doing the research or even trying to present it in a wider audience. And then there's an infamous term that is used, doing a quick and dirty research, where you don't want to do everything, but you just want to do something to, for example, look for benefit and then make it to inform practice. So like in a case, maybe if I can give you an example, assuming that probably for patients with catheter-related bloodstream infections, for example, there are different practices out there. And you might find in terms of doing catheter locks, people use ethanol locks, others use gentamicin with heparin. So they are both documented, but they have different benefits. But for me to inform practice, I probably want to put a set of patients on maybe ethanol locks and a set of patients on probably, gentamicin and heparin and see who benefits the most. So probably I do have the patients have signed consent, which is informed. I've taken care of all my bases, but now the question is, do I still need to go to the Ethics and Research Board to just tell them that as much as I'm running a pilot study, I need approval for this? As much as I can call it a quick and dirty in this case.
If you're asking an ethicist, that there is no such thing as quick and dirty. Okay, we are ethicists.
Yeah.
We're clean. Okay, so having said that, look, you know, you see, in an academic institution like ours, okay, at the university, etc., we will not allow
Mm.
any researcher to do something of that nature. And if the ethics committee picks it up, they're going to stop the study. Okay. Having said that, you know, one of the things that we have in place is what we call an expedited review. Okay, so expedited means that it's not a major interventional study, it's not a big study, etc. You're just doing it to inform practice because it's standard of
Mm.
care. So this is not something new. You
Mm.
understand? I mean, it's
Yeah.
a patient, the nurse might decide she wants to use ethanol and gentamicin lock in one patient. She might want to use, something else, or another patient, right?
Mm.
So
Mm.
the thing is expedited, so it's a simple process, and we can just tell the ethics committee that, look, this is a proposed thing, this is what we're going to do. We're going to randomize the study to this and this, and we're going to inform patients about it. Okay, and this is standard
Yeah.
of care. So it's a very simple process, and when an expedited review takes place, we are not what I presented to you was like for major clinical studies, etc., which we do. Okay, so for instance, you have something else, like a vaccine study for HIV using neutralizing antibodies. I'm talking about those are major studies. But yours is just a pilot study. If you want to do that, then an expedited review. As long as ethics is informed about it, and you just consent the patient to say, look, we're taking a simple consent from you to say this is what we can do. So you might get this or you might get that. That's fine. So it's an expedited process. But I
Mm.
don't think so. Ethics will allow it without approval. Okay? So if you're asking me
Okay.
that, then the answer is no. I can't say. Okay, there's no quick and
Okay.
dirty. Sorry.
Uh, thank you for that. I think it's
You're
also
welcome.
good because on our end at AHN, we've just actually formed an institutional ethics and research committee, which basically maybe once we get registered and also get licensed, we'll be able also to review some of the research before we take it to the board. I think we'll also tap into your at least your expertise in this, since
No problem.
you're well versed in it. So we'll be touching base quite a bit. But
Okay.
yes,
No,
very,
you're
very
welcome.
insightful, very thought-provoking. I think sometimes we take pilot studies not to be, the actual research, and you think that since there's beneficence in both, you can proceed without even going through the red tape that is there. But I'm well guided, so thank you for that.
It's not because we discouraging research or trying to stymie anything. It's because
Mm.
in the event of any litigation,
Yeah.
you are covered. You know what I mean? So
Mm.
one of the first things that the attorneys are going to ask you, especially if you're saying I'm doing this as a pilot study, is
Mm.
did you have proper ethical approval and consent for your study? And if the answer is no, you got no
Mm.
leg to stand on. You know what I mean? Right? Whereas if
I
you
agree.
have done it, you know you are safe. You know what I mean? Okay.
Yeah,
Okay. So the
100%.
ethics committee
100%.
there is to facilitate your research, not to try and stymie you. You know what I mean? See?
Yes,
Okay.
I agree. I think it's better to be safe. In healthcare,
Mm,
we're always working on eggshells, so you never know when one will
absolutely.
crack.
You never
and
know
we don't
when
want
you're
to be
going to
sued.
have a problem. And it comes at the worst of times and the least
Yes,
expected. Yes. Okay.
agreed. There are no questions in the chat box. I know it was quite
Okay.
informative, but I'll probably give an opportunity for anyone with a question to just they can use the raise hand feature. I'll simply unmute you. You'll be able to ask your question live. Or I think Dr. Lloyd has unmuted. Maybe he has a question. Dr. Lloyd?
Yeah, yeah, yeah. Thanks, Dr. Bhimma. Wonderful, wonderful session. I mean, very, very informative and very important stuff. Very, very important stuff. Yes, first thing in the ethics, first thing in the research part is do no harm. Right? That's first thing. Second thing is
Yes.
we protect ourselves when you do it, and that's extremely important. What you've said, everything step by step. Thank you so much. Now, one basic question is, info when you actually you are treating a patient, okay, you take an informed consent, right? So you explain to the patient, number one, what you're going to do, number two, what are the side effects, number
Mhm.
three, what are the alternatives available? And number four, what happens if you don't do the original procedure? These are four steps when we take an informed consent, that you have to make sure that the patient is informed about all these four steps. Now, how does this differ? Is there or is there a difference from a research consent against the routine informed consent that you take in treating a patient?
So you mean that if you're having, say, a pharmaceutical company wants you to do a research study on a drug which is
Yeah,
not licensed for use, okay, at the present moment, right? So it's not approved by your local, so we call it SAPRA, okay? It's a South African, what do you call it, pharmaceutical and health professional research licensing, right? So
yeah,
basically, it's not too much different, Lloyd, but the
yeah. Okay.
difference is that you have to state that this medication has not been available before and is not being approved for use and is part of an experimental study designed to look at this. And you understand? I mean, the first statement. You
Yeah,
know what I mean?
yeah,
Right.
yeah, yeah.
So other than that, the rest of the processes that you outlined are exactly the same. Remember, research is not very different from routine because after all, in translational research, when that medication is going to come into routine use, you
Yeah,
have to consent it. You know what I mean? Right.
yeah,
So if
yeah,
I'm giving cyclophosphamide to a patient with nephrotic syndrome, I have to
yeah,
inform the mother and take a consent from her to say, look, the potential side effect that is your child might become sterile. You know what I mean?
yeah,
Now,
yeah, yeah,
it's very important that she
yeah,
understands that. So it's the
yeah,
same process. It's just that in an experimental study where you're doing it as part of research, you have to declare,
yeah.
like I said, you must declare it is part of research. You know what I mean? You cannot say it's
Okay.
part of routine clinical care. See?
Yeah. Okay.
So that's what we look at. Okay.
Yes. Yes.
So you are
Thank you
right.
so much.
You're
Thank you.
welcome.
Thank you, Professor Bhimma. Not sure whether there are any other questions, but I think it's getting more clearer and clearer as
Yeah.
you're discussing it. I think you always have to cover our bases,
Yeah,
always over communicate. Yes.
it's it's I mean I myself both sit on both sides of the fence. I sit on the ethics one, but
Mm,
I also do research. Okay, and I myself, when I write up the informed consent, I always tell the pharmaceutical company, please pass it through me before you send it to ethics. Okay, because I can look at it, go through it, and see all the essential steps are there. You know what I mean? And that's what we do. We just tick off the essential things which I highlighted. So I try to break it down for you into each step to say these are the essentials that you must have in an informed consent. So once you follow those steps, you high and dry. Okay. So I hope it was clear. Thank you very much. Okay, I really appreciate it. And thanks for the invitation, Lloyd, for allowing me to present. Yeah.
thank you, Professor Bhimma. Very clear. Thank you for the guiding steps. And like I said, we'll be actually nudging you quite a bit
No,
just
that's
to
fine.
ask
You're
a
most
few
welcome.
questions.
Sure.
I know we also have
Most
quite a
welcome.
number of ethical dilemmas here and there, so we'll probably seek guidance. But I just want
Most
to say
welcome.
thank you for making time for this presentation, a very important topic, and hopefully the participants have also been guided and more informed and enlightened, and looking forward to more discussions, especially from you. And again, to our participants, thank you for making time and staying up to the end. And to our panelists, I also want to say a big thank you on behalf of Africa Healthcare Network, and I wish you a good evening. I'll let Dr. Lloyd just have some closing remarks. Thank you.
Thank you. It's a phenomenal session. Thank you very, very much, Dr. Bhimma. Very, very important session, and very well outlined, and the sample piece that you showed us. And I think, please give us the slides. I will distribute.
Yeah,
I would love
sure.
to.
I'll send it to you.
Well. Very, very important. Yeah. So, thank you so much,
Thank you.
Bhimma. Thank you so much.
Okay. Bye bye.